For future. Okay. Okay, can you all see my first slide? Just one of you answer.
Yes.
Yeah. So slide's working fine, and you can all hear me. In which case, I'm assuming we can go for this. Okay. Well, good morning again. Reason I thought I'd put together a talk on bovine herpes viruses was twofold. I mean, I did talk on IBR about, I think it was 10 or 11 years ago. Did a few talks then, so I already have material, should we say, in suitable format. But we also had a couple of interesting cases which reminded me that this is a disease which is common, but there are some interesting features which perhaps not everybody is aware of. And then as I did put the talk together, I then thought, well, why not expand it to other herpes viruses as well, which we come across and affect bovines. So I've expanded this. It is a talk then on virus diseases, but it's coming from me as a non-virologist, as a VIO, with what experience I have, and we'll talk on the disease aspects. But if there's anything particularly virological, should we say, then it's probably something I can't answer. Okay, let's go. Right, hopefully you're seeing rolling slides. If at any stage not, then let me know. Otherwise, if you mute your mics, please, and we'll see how we get on. So first and foremost, I'd like to acknowledge several people who are basically no longer with us, shall we say, as employees or working in other places. The Mordun people were always very, very helpful and very knowledgeable. Neither of them are there anymore. And these names of past colleagues, as you'll be aware, no longer with us. But I have material or data from them, and I appreciate their help in this. People are waiting in the lobby. Return to the main meeting window. How do I do that? Excuse me. I've got to now go to the lobby, but I'm not sure how I do that.
I can sort out the lobby if you want, Arthur, so you can concentrate on the presentation.
Can you?
Yes.
Oh, please do so then, and I'll pause for a second. Let me know.
Okay.
That's okay. It was Mick, and he's in now, so should be all right.
Yep. Okay. Well, if there's any others come through and you can handle that for me, that'd be great. I shall carry on with my chat. Okay. So this screen lists the herpes viruses that I'm going to talk about. So I've called them all bovine herpes viruses. Some of them are, as you will see on the list, not actually bovine in terms of the host species, but they do cause disease in bovines. So we will go through them in this particular order, talking with the big baddie to start with, and finishing with the notifiable disease, which is Jessica's disease. So BOHV1, which is the cause of IBR. It's an alpha herpes virus, closely related to a couple of other alpha herpes, which is suid herpes virus 1 and the human varicella zoster or chickenpox virus, which is human herpes virus 3. As you'll be aware, and I do appreciate you'll know a lot of this, so this is really just a refresher, I'm sure. But the non-essential glycoprotein gene, the GE gene, can be removed as it is non-essential for virus growth, and this has been developed now for use for marker vaccines, of which nearly all on the market now are using the marker vaccine technology. The one exception, as far as I'm aware, I believe it's now the only one, is Trecarine, which has been around for longer than I've been around, but is still available and is a non-marker vaccine. Antigenically and genetically, these are similar and stable, and so there's low risk of new antigenic variants emerging. There are two main variants of bovine herpesvirus 1. It's abbreviated to 1.1 and 1.2, and of 1.2 there are subtypes A and B. 1.1 and 1.2b are believed to be the only types in the UK and Ireland, and of those it is type 1.1 which is predominant. Now, it is reported that animals with 1.1 infection shed large amounts of virus compared with 1.2b, and therefore much more likely to spread infection. There is no specific tropism for respiratory or genital tract infection. It is the route of infection which is important. So it is essentially the same bovine herpes virus 1, which causes our respiratory disease and also causes reproductive disease. So how about sort of the epidemiological sort of features? The infection is introduced into herds through purchase or by contact with infected animals. This could be across the fence, this could be shows, this could be borrowed animals. Clearly lots of different ways this happens. In principle, it could occur indirectly through fomites as well. There are, with all herpes viruses, the potential for latent carriers to be established. So when we are looking at an infected animal, you don't know, or a diseased animal, you don't know whether that is one which has been a latent carrier or whether this is a primary infection. There's no way of differentiating that. It would be the herd history or the animal's history, should we say, that you would need to look into to determine whether this was a fresh infection. Once infected, animals are considered likely to remain so lifelong. And these animals are nearly always seropositive, but they don't have to be. And this is a problem then when it comes to trying to identify infected animals, particularly when thinking about purchase of stock going into other herds, or say with the companies like Genus and Cogent with bringing bulls in for semen production. Certain risk factors are not surprisingly recognized. So purchasing animals, the larger the herd sizes, the increased risk, and this is to do with increased numbers of contacts, increased numbers of visitors for the farms. The presence of dairy cattle per se is considered a risk. Presence of a breeding bull, high density of herds in a region, cattle visiting shows, although as you're aware they will have IBR free sort of areas. Somebody's not got a muted mic, by the way. If you could all check your mics and mute, please. And professional visitors not wearing PPE. Maternally derived antibody can last several months, up to 6, maybe even up to 9 months. It depends clearly on the amount which animals absorb as calves. And often young stock in herds will remain uninfected until they enter the adult herd. And it is at that point that meeting the virus being carried in the adult herd when you can get breakdown and disease occurring. And finally, with epidemiological features, the virus can survive in the environment for a period. So it's been reported that between 5 and 13 days in warm buildings, and that a distance of 4.4 meters should be sufficient to house stock to prevent spread from one group to another. The virus is considered to be host specific for bovines, except there is one single report of infection of water buffalo. So the prevalence of disease, well, not surprisingly, considering the changes we've gone through over this 10-year period, here we saw more disease in the period from 2010 through to 2014. Then we started to lose labs, and we also lost a lot of our laboratory submissions compared with going to private labs. So our numbers have decreased over recent years, but it is clearly still around. And the prevalence over the season, again, not surprisingly, because if you ran similarly dashboard charts for the other respiratory pathogens, you would see a very similar pattern. So the most frequently cases are encountered in the housed period, but we do also see it during the summer months, quite possibly then, though, to do with housing of animals. If we look at the prevalence figures for our monitoring of submissions, it's constantly there, but it's varying from year to year in terms of how frequently and the percentage of diagnosed cases. And if we look at the types of animals, this is a chart actually from my original talk 10 years ago, so the distribution over the season is just a little bit different in this chart, but not surprisingly, it is dairy animals, which are in the sort of pale orangey colour, which are the most frequently diagnosed. Now, this is quite interesting. So I've pulled together the most recent figures for the types of animals affected over the last 5-6 years versus the talk that I did, which was 2010. And it's interesting because if you look at the percentages of which types, then milk, as in dairy animals, when I did the last talk, 61% of all the diagnoses were in dairy animals, whereas in the last 5 years, that's dropped down to 45%. And there has certainly been a big push by the commercial companies to promote vaccination. And I would say, taking histories, I mean, I've noticed that many people now are reporting that they vaccinate routinely for IBR, whereas in the past some people would, but it certainly wasn't quite as common to have that in a history. And then the other percentages are slightly different as well. So a change in trend, should we say, associated, I'm fairly confident that that's to do with vaccination. So what about the tests to detect bovine herpesvirus 1 infection? As you'll be aware, then we can identify the virus by different means. So we have cell culture. This used to be done when I started as one of our standard diagnostic tests. I think we had 4 or 5 labs that used monolayer cultures, and swabs or tissue samples were taken, were put up in these monolayers, and IBR is a rapid cause of cytopathic effect in cell cultures, and the monolayer is usually sort of disrupted within about 2 days. That now is no longer done, obviously, as a routine. It is still there for working on virus, the nature of viruses, should that be required. The other routes of identification would be immunohistochemistry, which is occasionally used, and now most commonly we are using PCRs, either as a BOHV1 specific PCR, or there are pan-herpesvirus PCRs as well. And then antibody detection. Again, as you're aware, we've used ELISA routinely, probably for the last 25 to 30 years. But in more recent times, we've had extra ELISAs which have been introduced. So we have a bank of 3, the C ELISA, the I ELISA, and the GE ELISA. There's also SNT still available. This is the standard and gold standard test of the past. It is still required for certain export testing and can be used as a backup to the ELISAs, but the ELISAs are pretty good and have different features. So what are the features? And these are the standard texts which have been used to assist with interpretation. So the I ELISA, which is our diagnostic ELISA, should we say, and has been available on serum and milk, is used when an antibody titer is required. And it is the preferred test, therefore, to compare acute and convalescent sera when you're looking for the presence of rising titers to show an active response. Now, as I said in one of the earlier slides, that doesn't necessarily mean it's new infection. It could be latent infection which has been triggered to kick off again. The important thing with IBR as well, with an eye ELISA, you can do paired serology very quickly. It's a very quick seroconverter. So if you are faced with an outbreak and you are advising the vet on sampling animals looking for IBR, well, clearly you can go looking by PCR, and that's relatively quick too. But you can take paired samples 7 days apart, and you will get significant seroconversion rise in titers in that time. This compares with most of the other viruses that we advise on, like BVD, like coronavirus, Schmallenberg. They're all recommended to take samples of 3 weeks or longer intervals. With the eye ELISA, then most animals are seropositive after infection, and nearly all become carriers and intermittent shedders, as we have said. In the past, in fact, some what's the word for it? Some corticosteroid treatment was used to actually look for animals that were considered to be latent but seronegative animals, to try to induce these animals to go from a latent state into an active state and detect rising antibody titers. I'm not aware that's been done for a long time since, but it was used where there were herds that were of high status and had suspicion of infected latent animals that they wanted to identify. Anyway, enough of that. This particular serological test does not distinguish between vaccine antibodies, including the GE deleted, and field virus antibodies. So you'll get a positive response, whatever the antigenic stimulation. The next ELISA is the C ELISA, which available only on serum, and this is the preferred test to determine is an animal infected or uninfected status. It is reported to have a higher sensitivity than the eye ELISA, but is not any more specific. They're both highly specific, but this is not considered to be more specific. And it is the test of choice for monitoring cattle for sale or for export. It's also the statutory test used for AI purposes, and you get a simple positive or negative result. So people sometimes phone up to ask for advice on people purchasing animals into a herd. The C ELISA is the one which is usually recommended for this reason. And then lastly, there's the GE ELISA. This is the test to detect antibody to the GE antigen, which is then removed from the vaccinal strain. So cows vaccinated with the GE deleted vaccine should be negative if they are BOHV1 free, and positive results indicate either that the animals have had conventional vaccine, which would include, as I said earlier, tracharine, or that there's field virus infection. Okay. So let's talk about the disease syndromes that we get with bovine herpes virus 1. There are essentially 4 different types of disease syndrome. And the most common by far, so we're talking about 95+% of cases, we're talking about respiratory disease. And I've listed the samples really which we would use to be investigating for making a diagnosis. There then are also reproductive diseases, digestive and or systemic disease, and nervous diseases. Certainly reproductive disease is not uncommonly considered, but quite uncommonly identified. Digestive and systemic and nervous diseases are fairly rare, but I wanted to cover these because they're quite interesting, and they are conditions that we should be aware of and should look out for. Firstly, then, let's talk about respiratory diseases. And in all ages of animals, it's predominantly upper respiratory tract infection. The virus has a tropism for the ciliated epithelium, so it's the upper respiratory tract. So you will get lesions of the eyes and the nose, and these are good sites for sampling in live animals. The eyes, you get cleaner samples The nose certainly can be used, even with short swabs. That's something you can get away with. And obviously at post-mortem examination, we would tend to take samples from the trachea and maybe the lungs. And certainly we have been able to identify positive cases by sampling and testing these areas, and more recently with higher sensitivity using the PCR. In adults and growing animals, infection by bovine herpes virus 1 can be a mild disease, and in dairy herds it can be associated with a milk drop and not much in the way of clinical signs. But it is often a cause of severe and fatal disease in adults and young stock. And in some outbreaks that we get, there can be several animals affected. My impression is that we used to see much bigger and more severe outbreaks in the past, and we tend to see more limited numbers now. So 6 animals affected and die these days. I'd have said we probably saw 20 plus animals in the past 20 years ago. So whether the virus has deteriorated, has reduced in its pathogenicity, or whether it's to do with the management and the treatment and the use of vaccine, I'm not sure on that. In calves, it is a very uncommon condition in animals less than 6 months of age. It is almost not worth bothering looking for. This is to do with, if somebody lets somebody in from the lobby again, thank you. This is to do with the strong protection from maternally derived antibody, and to do with how the animals are actually sort of managed and mixed. We occasionally get reports of very young calves being affected up to a maximum of about 14 days of age. And in fact, SRUC have had 2 outbreaks reported in the last 2 years, I think, of disease in young calves. And when you get it in such young calves, we're talking about neonates really, this is when infected animals are introduced to or mixed with late pregnant stock. So respiratory disease, clinical signs, it does what it says on the tin, basically. It causes a rhinotracheitis. So rhino is nose, tracheitis, trachea. Those are the principal places. And so it is something which, again, in my experience, practitioners have missed identifying the lesions, because they'll open and do a post-mortem examination and look at the lungs, and they won't bother looking at airways. And it is the trachea for me which is the absolute must-have lesion for IBR. So ocular and nasal discharge, conjunctivitis, tracheitis, perhaps I should have put it in big letters. Pneumonia really is a secondary effect. It's really aspiration of rubbish from the trachea down into the lungs, which is quite often setting off the pneumonic pathology. Animals are typically pyrexic, and abortion. Now, abortion can occur for 2 reasons. Abortion can be caused by direct infection and the systemic spread of bovine herpes virus 1, and I'll go on to talk about that a little bit later. It can also be a consequence of simply an animal that is so sick and pyrexic that it aborts. And those cases then are not directly, should we say, caused by fetal infection by the virus. Here's some signs. These are from Peter Nettleton's In Practice, which I've taken a lot of the introductory information from, and I do recommend having a look at that. It's a very good sort of summary. So nasal discharge, bilateral, usually purulent. Conjunctivitis can be severe, purulent flecks coming from this particular animal. The tracheitis is severe, it's necrotic or necrohemorrhagic, and these animals, if they are examined, will often have a marked halitosis. Coughing. Now, just as a reminder, this is for those who have been around for a bit longer, the test that we used to use for identification of bovine herpes virus 1 was fluorescent antibody test. And this is the this is what was seen then with such samples. So on the left we have the epithelial cells that would be either taken from samples that we take from post-mortem or from swabs, should we say, and we're looking for fluorescence of the epithelial cells, which is shown here. And then it was also used to confirm cell culture infections before the cytopathic effects, and you can see the labeling of cytoplasm of these in cell culture. Going on to post-mortem findings, upper respiratory tract pathology. As I say, it's a must-have that you have a tracheitis. This also shows a severe necrotic epiglottitis and laryngitis, and you can see going on down the trachea, we have thick necrotic crud, almost filling the lumen. But when trying to instruct people on how to differentiate this lesion in the trachea, I tend to say, you know, it's adherent, it's uneven, it's necrotic or necrohemorrhagic, versus when you have pneumonia with other causes such as bacteria, and you will tend to get exudate there in the trachea. If you run your thumb along the mucosa, that will sort of cleanly come off, shall we say, but with herpes virus infection, you get this thick, adherent, and irregular adhesed exudate. This is another picture then of trachea open to show the nature of this, and in some of these cases you will get so much exudate in there you are basically looking at asphyxiation as part of the reason that these animals die. And here's another picture showing thick clumps of purulent or necrotic exudate in this trachea. And then, as I said earlier, you will get pneumonia in many cases, not all cases, but you will do so. We had one a few months back that Moina did, where we actually had very severe pneumonic lesions and marked bullous formation as well. Now, everybody thinks bullous, oh, it's got to be RSV. No, we had it with IBR. And if you think about it, if you're going to aspirate this sort of stuff down into the bronchioles, you're not surprisingly going to cause then blockage, and that's then the trigger, the mechanism to cause emphysematous bully in the lower areas of the airways. So that's respiratory disease. Fairly straightforward. I think most of us will have seen that numerous times in my case, and it's a pretty characteristic picture. What is very uncommon with bovine herpes virus 1 is nervous disease, and I did show in one of my case reports I did last summer in our summer conference. I did show these pictures before, so apologies, I'm going to show them again. It is, though, very uncommon, and when it occurs, it will arise either as sporadic individual cases or potentially outbreaks affecting animals. Now, in calves, it is considered that the disease affecting the brain is possibly an extension from an oropharyngeal infection. So this would be then transferred either via the middle ear or clearly via nervous route to the brain from the oropharynx. In older animals, again, the origin is uncertain. There's no clear reports on this. It is considered that infection could therefore reach the brain via the bloodstream or via the cribriform plate from the nasal mucosa. This was the case that I had back in, I'm just looking to see, about 2005, which was a weird. This animal presented with acute onset signs, neurological signs. It was blind. It was charging around. It was opisthotonous. It was fit. It had very bizarre, inconsistent, shall we say, signs, and was put down, and the head submitted. And when I opened the cranial cavity, this is what I saw. And I actually had to sort of check that this animal hadn't been shot. I went back to the skull and just checked it. No, it hadn't been shot. And yet you can see in the right-hand picture, I mean, this focally extensive necrotic necrohemorrhagic lesion, it's not dissimilar to what would happen with a captive bolt. But that was the lesion in this particular animal. And this was confirmed to be bovine herpesvirus 1 by Sandra Scholes, who did the histopath. And the histopath description, the morphological diagnosis, was a panencephalitis. Panencephalitis refers to the fact that the inflammatory lesions are affecting all areas of the brain, so both grey and white matter. Now, I'm no expert on neurohistopathology at all, but certain diseases will maybe focus on white matter, some will be more affecting grey matter. This particular case, it was very much all white and grey matter affected. There was clearly hemorrhage there as well, and the confirmation of disease in this case was actually done by initially in situ hybridization, I seem to remember, to confirm the presence of bovine herpesvirus 1. So that's nervous disease. It's unusual, and it's something which is probably that won't come across most people, but it is something which we are most likely then to find if our histopathologists indicate it is that type of lesion which could be consistent with bovine herpesvirus 1, and then we have immunohistochemistry which we could use on brain. The other thing, similar to a reminder sent out by Vanessa in the fortnightly for pig diseases, and I sent out something several months back with bovines, we should do the same. We should, with all nervous disease cases, collect some fresh brain and hold frozen, should we want to go back then to look for virus following our histopathological examination. So next then, digestive or systemic disease. This is a condition which is again rare, but recent case down in Carmarthen reminded me that this is worth talking about. So it is something which is seen in neonates, as I said, up to a maximum of about 14 days of age, but more commonly they start showing signs within the first week of life. It may follow an outbreak of respiratory disease in older cattle, and it is typically associated with the introduction of infected animals to stock which are in late pregnancy. It can also occur if you are mixing naive pregnant heifers with older infected cows. And this is not uncommon practice in some herds, whereby the farmers will want to get the heifers used to the socialization, shall we say, and the housing and the diet. And so this is a risk factor when there is bovine herpesvirus 1 unchecked, shall we say, in the herd. The pathology with this condition, the main focus of pathology is the liver, and you will get a hepatitis, which will in some instances be macroscopically visible. So I had a case back in the 1990s, and it did have this lesion which we call sawdust liver, where the liver was swollen and it had multiple, they were pale lesions. And so sawdust liver we term as a gross pathological sort of saying, and it is multifocal necrotizing lesions, but doesn't have to only be bovine herpesvirus 1. Clearly we see it as well with the likes of listeria, sometimes with salmonella as well. But it is something then which should perhaps trigger thoughts that, could this be viral? As I say, it's in neonates, so this would be limiting to this age group. And you may see the same pathology in aborted calves as well. I say may because many aborted calves, clearly, with the condition that we get them, they are not that fresh, and those lesions are fairly subtle, so they may be missed. You can also get with bovine herpesvirus 1 in neonates upper alimentary tract ulceration, and this tends to affect the oropharynx and the esophagus. I'll show you a picture in a minute. is also reported in the literature that you can get necrotic lesions also extending into the forestomachs, and in neonates occasionally, in addition to hepatitis, so a systemic spread to the brain, where encephalitis may also be detected by histopathology. And you'll see the reference to this. So Robert Higgins was a VIO at Thirsk who specialised and went on to do just histopathology in his latter years in Lasswade. Robert was an excellent VIO and histopathologist. And Edwards is, of course, Steve Edwards, who was our chief executive. And Steve Edwards did a lot of the early work in Weybridge, confirming that bovine herpes virus 1 was a significant cause of abortion. And in those cases, experimental infections were done and animals would abort within 2 days or so. He confirmed and reported that infection was extremely rapidly fetopathic, so much so that you tended to get an acute necrotizing placentitis, but didn't tend to affect the fetus. So the fetus was expelled before it was infected. Anyway, that's as an aside. I just thought I'd fill in a bit of historical sort of reference to 2 of our former colleagues. So this is a picture of an esophagus from something like a 7-day-old calf. This was, and these are linear and coalescing ulcers along the length of the esophagus, not dissimilar to what you see with BBD virus. They are essentially screaming at me that they're viral. And when you see lesions like this, then, you know, viral etiology, we then need to go looking for which virus it is. So histopath and suitable tissues and tests for viral infections. Then to confirm infection in this particular case, then histopathology was done with immunohistochemistry, and clearly the brown staining is confirming the bovine herpes virus 1 antigen. Okay, so the next, I think this is the final now, type of disease that bovine herpes virus 1 causes is reproductive disease. So we're talking about adult animals or heifers becoming adults, and abortion can occur in herds following outbreaks of respiratory disease. The abortion episode may well be delayed by a few weeks, and it can also be associated, as I've already mentioned, with the birth of live congenitally infected calves. The calves, as either aborted calves or born alive, as I say, if they are affected with pathology, then it is hepatic lesions and or digestive tract lesions, as I've described. Now, infertility is also, you will see, mentioned lots by the drug companies. And I think with the big push in development and selling of vaccines, excuse me, which started about, I don't know, 10 years or so back, there was a big sell. I certainly went to a couple of talks, and the big push was that, you know, so much infertility in herds was down to IBR, bovine herpes virus 1, whatever, and vaccination clearly would sort of cure all ills. It is rarely diagnosed, that said, that it causes infertility, but it is essentially often blamed enough to sell vaccine anyway. So that's my slightly skeptical view, which Mick Miller, I'm sure, will appreciate is me all over. But it is just that, because it is rarely diagnosed with certainty, it's not really proven. And if people are selling vaccine, then they're probably also going to improve, being sold vaccine, they'll probably also improve other management factors to improve their fertility. The other condition which it is renowned for is infectious pustular vulvovaginitis or balanopostitis, depending on whether it's the female or the male. And this is a true sexually transmitted disease of bovine herpes virus 1, and the infection will affect only the reproductive tract. It will cause latent infection in the in the ganglia of the pelvis. And so animals, once they're infected with this, remain infected. So it's bad news, certainly, particularly for the AI companies. It is very, very rarely diagnosed. So I checked the figures for the last 20 years for England, Scotland and Wales, and there were 4 diagnoses. We had a diagnosis last year from samples from a practitioner. And, you know, it just shows how rare it is these days. So not only because of vaccination, which will protect against the respiratory and the reproductive disease, but it is more so because so many herds now have done away with natural service, and the use of AI alone is clearly going to prevent transmission of infection by sexual means. So what sort of lesions do you get? Well, this is not brilliant photograph. I apologise. So with hepatic lesions in either aborted animals or neonates, you get multifocal necrotizing lesions. As I say, grossly sawdust liver, pale foci. Histopathologically, you see these foci of necrosis of hepatocytes. And if you go to a higher level, then you may have hepatocytes which are intact and will show intranuclear inclusion bodies of herpesviruses. And that's pretty much characteristic and diagnostic. So here's what the lesions look like on the male, and they are, again, screamingly viral, shall we say. So you have multifocal vesicular lesions. I dare to mention vesicular and not go down the route of notifiable disease, but these are the vesicular lesions of the penis and prepuce. And very similar looking lesions would be found the vulva of the female. And swabbing these and then PCR testing in exactly the same test manner as we use for respiratory disease is how diagnosis is made. So these are slides from the More Done from Kim Willoughby from years back, which is it's quite an interesting little series, which well, it was interesting then. I think it's still interesting. So it is known, as I say, Steve Edwards was one of the people who started work on this and showed that if you infect cows that are pregnant, it is rapidly fetopathic. I do love these images, I have to say. It really just says it very simply. And in those cases, you can identify the virus in fetuses, but not always, as I said, because it does cause a rapidly necrotizing placentitis. So what's known in the UK, it is an uncommon diagnosis to identify bovine herpes virus 1 as a cause of abortion. If it is made, it's made on histopathology, and liver, as I said, is the target organ. But we don't routinely go looking for it. We haven't been doing any specific testing for IBR stroke bovine herpes virus 1 in aborted fetuses for many years. I think if we had a focused investigation of an abortion problem, we should be doing it, but we don't routinely do so. And liver lesions, as I said previously, would be confirmed by immunohistochemistry. So what's been reported elsewhere? Well, in the Americas, much greater sort of reports of severe or large abortion storms were made in the 70s and the 80s. And looking then at aborted fetuses, the virus, and as I say, in those days, this would have been by cell culture. So the virus was detected in between 18.4 and 35% of abortions reported in one of these studies. And in a 1992 survey of almost 9,000 samples of aborted animals, then bovine herpes virus 1 identified in 15.4% versus BVD was found in only 4.5%. So it was certainly a much more commonly identified organism associated with abortions. Now, in a study from the SRUC back in the 1990s, George Caldo and Dave Buxton. So Dave Buxton used to be in the More Done, reported a survey there for their abortion submissions, 356 submissions. They went looking for bovine herpesvirus 1 by virus isolation and by histopathology, and they detected no cases. So what was done more recently? Well, in 2007, Kim Willoughby, working with the SRUC, did a trial on 188 aborted calves. And they looked at by two test methods, virus isolation and then relatively newly developed real-time PCR. So virus isolation on the same tissues, selecting particularly liver, but as you can see, there's a range of samples that were used, and they identified none by virus isolation, compared with 5 cases were positive by PCR. In one of those, the original diagnosis had already been made as bovine herpesvirus 1 by histopathology and immunohistochemistry, and it had also had Bacillus licheniformis isolated. 3 of them had been identified as suspected bacterial etiology, and 1 suspected leptoharjo on fetal serology. So not many cases in total, but does just go to show that it's actually then perhaps been missed anyway by previous methods in going looking for it. And so the use of PCR is, the message from this, is the test of choice for its sensitivity. Now this, if those of you know about how PCRs work, just then indicates where the virus is in fetuses, and it is essentially the second column, which shows how great a titer, should we say, of virus is detected, and the liver, huge titers or huge amounts of virus compared with the other tissues that were tested. Even compared with placenta. So liver is the organ of choice. On H&E, multifocal necrotic lesions identified, and immunohistochemistry confirmed as well. So these backup tests did actually then confirm that these cases had that it was possible to identify infection by other means too. So in a study then, or a summary of all their samples tested, this must have been another survey. I seem to remember, as I say, these slides are from 10 years back. 339 pooled samples were tested, again at the More Done by PCR. 8 positive samples versus none were positive by virus isolation, which is interesting because virus isolation is still considered to be the gold standard. But for fetuses, and maybe it's because of the quality of the tissues, but for fetuses, it is clearly not as sensitive as using PCR. And then this just shows the backup testing of H&E testing and then immunohistochemistry to confirm the identity of bovine herpesvirus 1 in those fixed tissue samples. The conclusion, real-time PCR is a useful diagnostic tool, particularly in cases of autolyzed tissue. And as I said earlier, I think when we have abortion outbreaks where we are investigating and not getting anything from our initial stage 1, stage 2 test, then this is clearly something which we should be considering and testing for. Just then, this is not a commercial break. I'm grateful to we have a contact here locally who's now she's not now a field manager, but she's in Zoetis, Alison Anderson, and she kindly provided me with a 2018 PowerPoint, which they use with their road shows, shall we say, from Zoetis. She did say she wasn't absolutely sure that it was up to date, but I sent it out to you as well, so do scan through that if you're interested. That details essentially their talks and the use of vaccination against bovine herpes virus 1. 2 slides I've pulled out of that just to sort of make the point for vaccination. The vaccines, as I say, other than Tracharine, are all now marker vaccines. But there are 2 types of vaccines which are now used. There are live and there are inactivated. And I don't understand the absolute virological or cytological or whatever it is basis for these, but they are used in different ways. Live vaccines, though, are recommended for naive animals versus inactivated vaccines are used in infected animals to suppress virus shedding. Then this is their commercial sell. The Zoetis vaccine is the only IBR vaccine licensed for use in cattle at immediate risk of disease. So they say in the face of an outbreak. So that's this particular vaccine versus, say, Tracharine. Tracharine has the advantage, and I'm sure it hasn't changed in its nature, that if it is used in the face of an outbreak, and certainly is still done so, it is given as an intranasal, as you're aware, and it will stimulate a gamma interferon response within hours. And the gamma interferon response is virus non-specific, but clearly we're aiming it against bovine herpes virus 1 here, and so you do get a beneficial viral effect within a very short time after administering. So it has been used in the face of outbreaks in the past, I'm aware of, and can quite quickly, within a couple of days, bring an outbreak under control. So I have a lot of time for Tracharine, I have to say. I'm not sure how well this particular vaccine works, in terms of how quickly the uptake is. Tracharine mainly stimulates an IgA response, although it does trigger some IgG as well, whereas these are systemic vaccines. Lastly, only BHV vaccines to provide protection from bovine herpes virus 1 abortions, according to their spin as well. And then lastly, from their slide collection, then this one on vaccination. So they have a 12-month rolling sort of program as to how to immunize the herd, starting with a IM dose of a live vaccine, and then followed by inactivated vaccine at 6 months, and then boosted at 12 months. So this is the protocol which is now recommended in using these live and inactivated. As I say, I've included that if you want to have a look at any more detail. I don't fully understand it, but that's where Zoetis and the other companies essentially are coming from with this this modern generation of vaccines. So that's the end of bovine herpes virus 1. If you're okay, I'll sort of go right the way through, and then if anybody's got any talks right at the end, I'll do so. So I've got the other viruses now to come. So the next one I want to talk about, bovine herpes virus 2, causes 2 diseases. Firstly, bovine herpes mammalitis. And it's something which is something which I've sporadically discussed with practitioners over the years, but I haven't actually seen it myself. But I've quite often sort of discussed about outbreaks of it and how to sample. And sorry, my computer's just going. And it is a condition which can be very alarming and very concerning, should we say, for farmer and vet when it does arise. It causes ulcerative ulcerative lesions of the teats and udder, and this is important because most of the other viral infections of the teats that we see in cattle are predominantly, if not solely, seen on the teats. But mammalitis classically starts on the udder and spreads to the teats. It's usually seen in dairy heifers as they enter the milking herd. Somebody by the sound of it's got a mic on again, by the way. If you could all check your mics. And it is most commonly or traditionally it is seen in the autumn. So dairy heifers, soon after joining the dairy herd, autumn, they tend to be the main features of outbreaks that would suggest that this is likely to be mammalitis. And then, as I say, lesions, udder onto teats. It often arises soon after calving, which is a known stressor, and it will be seen in open and closed herds. So infection brought in or could be latent on the farm of origin. And then the animals, as I say, coming into this infected group, which is why heifers are so prone to this condition. It is hypothesized that it can be spread by biting flies, but I don't think it has actually been confirmed, and tends to be sporadic. So you see nothing, and then suddenly you get an outbreak, which can be, say, severe. It has even been reported affecting several herds in an area as well. How this is from the past and how good that biosecurity aspect is, well, I don't know. So you initially get vesicles on the udder shortly after calving. These rupture and they form red scabs, and then the lesions will also spread to affect the teats. You will get sloughing of the teats and the udder skin starting approximately 1 week after the first signs. And despite this, remarkably, as I say, I've not seen it, but I've seen a lot of pictures. I'll show you a few nasties now. Despite this, these animals will continue milking, and the animals can continue to effectively be part of the herd so long as the the secondary infection is controlled. So particularly bacterial infections, but as I show, potential for fly strike and other things are also an issue if we're still in the earlier autumn months. Many of these cases resolve despite such severe lesions, but some end up being culled. There is the possibility of secondary mastitis, that you can get granulation tissue, and you will see foul smelling lesions, and some of these lesions will actually wall off and actually basically just fall out. You can also get muzzle and mouth lesions of the calves born to these animals. This is uncommon, but it may occur, and these lesions closely resemble those of bovine papillostomatitis. And of course, then maybe somebody may even sort of mistake them for foot and mouth disease. Laboratory tests for bovine herpes mammalitis or bovine herpes virus 2. Virus identification at the moment, the only test available is to look for it directly by EM. There is also serological test. It's a SNT, so old-fashioned titer, and you need to look for rising titers. So these are the lesions that are there. So this is one I've downloaded from somewhere, so it's not especially clear, but you can see these brown coalescing ulcerative patches on the udder and spreading down onto the teats. And then this picture is from a case report in the vet record, which was from former colleague of ours who was at Liverpool. Richard Kemp, he's now gone back into practice in North Wales. So he and Andrew Holliman and somebody else, I think, reported this, and this was a particularly severe outbreak. And you just look at these lesions. I mean, this is severe, coalescing, ulcerative, necrotic. It's just amazing. And these animals were tolerating this. Some of these animals were certainly culled. This is just horrendous. This is necrotic granulation tissue. It amazes me that these animals survive to this stage, but they can. But this was a severe outbreak, and in this case, they also had these lesions, which were on the muzzle and lips area of calves as well. So, as you see, these look not dissimilar from bovine papillostomatitis when it breaks out in this way. Now, this is interesting because this is pseudo lumpy skin disease, which is also caused by bovine herpes virus 2, or in this case known as the Allerton virus. And it seems to be due to geographical distribution of this particular type of virus rather than any specific quality of this virus to cause this disease. So this is a condition which is usually encountered in Africa, and it is either rare or never occurred in UK. I'm not absolutely sure on this. I believe it's never occurred, but I'm not absolutely sure. It's also reported that infection occurs of wild game, especially buffalo, so therefore it's not species specific. But the lesions are similar, if not identical, to those of lumpy skin disease, hence its name, pseudo-lumpy skin disease. Lumpy skin disease is caused by capripox virus. This is a bovine herpes virus. The incubation period is similar, about 2 to 4 weeks, and infection is spread mechanically or by fomites or by flies. It is associated with nodular lesions which ulcerate, and you usually get a self-cure in 2 to 3 weeks if you don't get secondary infection or fly strike. And the diagnosis, detection of virus, for us, again, EM would be our only means that we have. And histopathological sampling of biopsies, you tend to get syncytial formation with intranuclear inclusion bodies of herpes viruses. So these are the sort of lesions that you get. This is in fact lumpy skin disease, but they are identical in nature, and you tend to get a predominance over the front end of the animal, but the lesions can be anywhere. So multifocal, nodular, becoming ulcerated lesions. Nasty looking things. This one now down, spreading down the neck, and in this case then down the legs, right the way down to the level of the coronary bands. Now, just a couple of mentions, because in the initial table I showed, there are 2 viruses in there, which basically Peter Nettleton's paper, which is only a few years ago, said, uncertain what's going on. And this is all that's known at the moment, all that's declared for bovine herpes virus 4. And I shall read some of this. Apologies. So bovine herpes virus 4, for some reason known as the Movar virus, similar to an Epstein virus, has been isolated throughout the world from cattle suffering from a variety of diseases. And this is where I start to lose faith in it, because it's been isolated from so many different sort of things. Next line is the important thing. Although there is no proven etiological association between these various diseases or experimental reproduction thereof, but recent reports suggest that bovine herpes virus 4 may be a cofactor in the development of reproductive diseases of cattle that are initiated by bacteria. So keep an open mind, keep aware of it, but at the moment there is nothing substantial to tie this particular virus to a disease syndrome with any certainty. So that's bovine herpes virus 4. Next, bovine herpes virus 5. It is a long list, I do apologise. So this is a disease which is thankfully not in the UK, or at least I can find no reference to it ever being in the UK. It is known as a cause of bovine herpes virus encephalitis, which was first identified in Australia in 1962. Outbreaks have been reported, though, also in South America, the US, and elsewhere in Europe. So 2 reports I could find, one in Italy, one in Hungary, both clearly a long time ago. It causes principally neurological disease, and it seems uncertain whether it can also cause the vulvovaginitis type lesions and whether it can cause abortion. But it seems to have a tropism for the central nervous system. Now, infection is believed via the respiratory tract, but possibly also semen and embryo infections are also considered a possibility, but I don't think these have been confirmed. And like all herpes viruses, you can get latency, in this case in CNS ganglia. The signs described are tremors, opisthotonus, nystagmus, teeth grinding, circling, recumbency, the usual gamut of neurological disease signs, and lesions in histopathology are similar to those of bovine herpes virus 1, as I talked about earlier. The disease is usually fatal in these animals, not surprisingly. So that's 5. This is 6. It's again an also ran. I do apologise. I was just going to very quickly say something about this because, as Peter Nettleton said, it's uncertain what's going on here. And this virus can be identified by identifying DNA, but it's the importance of this particular virus is unknown. So basically, it says here in the second line here, we describe the genome of bovine herpesvirus 6, a macavirus ubiquitous in healthy cattle populations. So again, just bear that in mind. It's another virus out there. It can be found, though, in healthy cattle. So whether it's got anything to do with disease or whatever, at this stage, nothing proven, something to be aware of. That's the end of the bovine-specific viruses. Others which affect bovines, which you'll be aware of now, we are starting now on malignant catarrh caused by ovine herpes virus 2. And this condition, we do see a seasonal prevalence, so we do see more cases in spring, but it is encountered throughout the year. Clearly, the cases in spring are probably most likely because of the likelihood of sheep and cattle contact being increased at that time of the year. Most often it is individual animals affected, but you can get herd outbreaks. So I investigated a herd outbreak when I was in Carmarthen, and that affected 13. It was pedigree Welsh blacks, which was 13 out of 77. So I can't remember what that was, about 16% of the herd. And so a significant sort of outbreak, and other outbreaks have been reported elsewhere. The infection is carried by sheep asymptomatically and generally regarded that probably all sheep carry it, is what the Morden experts, or expert at the time, Hugh Reid, said to me. It's basically considered to be everywhere in sheep. Cattle are infected either directly or indirectly, so via fomites, feed, equipment, or people. And it's not just cattle. I'll say later on that we talk about other species like deer, bison, and buffalo. So the Morden established many years ago a deer unit there, which was meant to be kept under conditions of the highest biosecurity possible, and yet they had, at the time I spoke to Hugh Reid anyway, which was some years ago, they had 2 breakdowns of malignant catarrh in their deer, despite their shower in, shower out, separate equipment, separate people, and everything else. And it shows that this virus can then get in by other routes, shall we say, and its predilection for causing disease in deer is in deer, and certainly certain types of deer more than others, is extremely likely. There's no cattle-to-cattle spread considered to occur, so each animal affected is considered to be infected directly or indirectly from sheep. The incubation period is declared to be usually between 2 and 10 weeks, but it can be longer. So even there have been a few chronic cases considered to have been infected several months previously. Cases have been diagnosed on sheep-free farms. We certainly have dairy herds here where we have had cases and they have never had sheep on their premises. Control relies on strict biosecurity. I shall mention that a little bit more later. And as I said, cattle are most commonly affected, or at least most commonly we diagnose it in cattle. But deer, bison, we have a herd of bison up in North Wales, and they continually struggle to keep malignant catarrh out, even though they have gone to a very high biosecurity level. Buffalo as well, and they have, maybe remember some of these. Mark Wessel's reported 1, if not 2 of these. It has been identified in goats, pigs, and sheep going down with disease that mostly they carry asymptomatically, but I think there's been at least 1 sheep reported with lesions consistent with malignant catarrh, the disease. This is the seasonality pattern. As I say, it's most commonly seen in spring, and so we see a peak in May, carrying on through June, July. This is one which interested me. I really thought that we probably saw about an even number of adult and post-weaned animals, but no, I mean, actually, animals way outnumber the post-weaned cases. I'm not sure about the neonates. I wonder if they're mistakes, but it is there. So adults predominantly and post-weaned animals. And there are 4 principal clinical forms in cattle. So the head and eye form, as it's known, is by far the commonest. At least 90% of those cases will be that, and it features pyrexia. I'm sorry, it's old money, but I still deal in old money. So between 105 and 108 degrees Fahrenheit, typically. Keratitis is classically, typically seen. So opacity of the cornea, oral ulceration. I had a case in Carmarthen where I had to call in the field services. I was relatively new those days, and I wanted somebody else to say, no, this is definitely not foot and mouth disease, but it can look very similar with coalescing ulcers which lift off the tongue. Can also affect the esophagus occasionally. The manifestation can be peracute, and certainly in deer outbreaks I've dealt with in deer, they're just found dead. But then how closely do you inspect deer anyway? But even in cattle, it can be very rapid to chronic. We're talking about animals which have been identified, they've had PCR positives, and they've survived for up to 8 weeks or longer, and eventually either die or are euthanized. Also, one of the animals that we had in the herd down in South Wales, Welsh Blacks, that was identified PCR positive, and remained healthy on afterwards, but did not go down with disease, and in the end was culled because, again, on Hugh Reed's advice, they're considered to remain infectious and have the potential to cause infection to their calves. But that's as an aside anyway. It's usually, if not always, fatal. I say that one case in Carmarthen proved that one perhaps wasn't. And persistent infection, then similarly, is considered possible as well for those that survive. The second version of clinical manifestation is an enterocolitis, and this was investigated and reported by, well, the first author was Andrew Holliman, who had the most cases, but Roger Daniel at Carmarthen and I think it was James Barnett at Truro had cases. So a letter to the vet record described these in 2007. So 5 affected herds in 2005-2006, and the features were pyrexia again, but a foul-smelling hemorrhagic diarrhea with fresh blood or blood clots identified post-mortem in the intestinal lumen. 3 of the herds also hematuria, or variably also hematuria, with bladder mucosal hemorrhages. And in some of them also ulceration of the esophagus and the abomasum. Death reported within 24 to 72 hours if the animals were not euthanized. There are 2 other forms of disease which are pretty rare, but have been also reported and identified by VI Centre colleagues. So a disease featuring nervous signs and pathology investigated and reported by Sian Mitchell and Sandra Scholes, 2009, and a cutaneous manifestation. I don't think it was the first report, but it was the first report I was aware of by, again, he pops up a lot, Andrew Holliman in 1994. So the nervous form that was reported in this outbreak from Sian Mitchell was in 4 to 5 month old calves. They were housed next to fattening lambs. I mean, some consider that it is pregnant ewes which are most likely to spread infection, but it can be all types of sheep at the end of the day. Pregnant ewes were later introduced in this case, disease starting then 1 month after their introduction. These calves showed opisthotonus, recumbency, they went down, they were paddling, nystagmus, maybe they were blind as well. Meningeal opacity over the cerebellum, seen post-mortem, cloudy CSF in 1 of 4 calves. Petechiation of the mucosa of the esophagus, trachea and bladder. And on histopath, a non-suppurative meningeal inflammation and of the grey and white matter, especially in the cerebellum. So histopath pathology to the rescue yet again. We are very dependent on them clearly for nervous diseases and many others. And then the cutaneous form, this report by Andrew, there are a few other reports there in the literature. This that he saw reported in 94 was a 12-month-old bull. And it presented with generalized exudative dermatitis. affecting the whole body except its head. And this progressed over a 2-week period, the lesions becoming fissured or cracked, and then secondary infections, but especially on the neck, these lesions were obvious. And you've got crusting, exudation, the skin becoming hard, and then foul smelling. And the lesions multifocal initially, and then sort of all joined up, and the entire skin was a mess. So this is the histopath from Sean and Sandra's paper, which shows the characteristic features. This is lifted directly out of their vet record paper. Next, we talk about the diagnosis for malignant catarrh. I'm a little bit short of time here. I do apologise, rabbiting on too much. So malignant catarrh diagnosis is by PCR, either on blood from live animals or lymphoid tissue. Spleen, lymph nodes are fine. And that is specific then for ovine herpes virus 2. On histopath, characteristic features tend to be lymphoid accumulation in various organs. And that includes the CNS for the enterocolitis cases that we're seeing. And this is helpful to differentiate from BVDV persistent infections. The other feature with malignant catarrh is necrotizing vasculitis. Vasculitis will also occur with BVD infections as well. Control and prevention, I did say, as mentioned this later, absolutely strict biosecurity. I mentioned the deer park and the bison up in North Wales, very difficult to keep out. Hugh Reid, when I was dealing with my case, I said, well, what advice do I give the farmer? And this was his advice. He said, kill all the sheep. You know, these were pedigree Welsh blacks. And yeah, if you don't want it there, keep it out. But as I said earlier, we have had disease in farms, dairy farms, where they've never had sheep on the farm. Here's some signs. So this animal's got bilateral keratitis. It's got this thick crust, ulcerative crusting on the muzzle as well. It's also sort of foaming, probably from oral lesions. Here's its sort of blue eye keratitis. More pictures showing nasal discharge commonly occurs, corneal opacity, and these erosive ulcerative lesions on the tongue, and in this case the esophagus as well. And these are the pictures from Andrew's case with the yearling bull, showing this exudative dermatitis, generalized and particularly severe over the neck region. Another case, this was reported from David and others, similarly severe crusting dermatitis, as you can see. Right, lastly, Ojeski's disease. Can't have a talk without having a mention of notifiable disease, can we? So Ojeski's disease is notifiable. This is caused by suid or pig herpes virus 1, otherwise known as pseudo rabies virus. In pigs, we are perhaps more attuned and should be aware of what this causes, which is where it's most likely to arise. In pigs, it is an acute, usually fatal contagious disease, and it is associated with either nose-to-nose, fecal, oral, or sexual transmission. But you can also get indirect transmission through aerosols and contaminated feed. In pigs, principally, it presents as nervous and respiratory signs. So you can also, though, get abortions and stillbirths, or you can get acute piglet deaths without any other true signs. In cattle and in other species, and there's a wide variety of species it can affect, including, as you're probably aware, dogs and cats, it is usually nervous signs and or a pruritus, and hence one of its other names is mad itch. Tissue samples are required for virus identification, which would be then done clearly at a specialist laboratory. I'm not sure whether Weybridge's are laboratory or whether it would be Pirbright. I suspect Pirbright. It is a notifiable disease, but the legislation actually states that this would require slaughter and compensation only for pigs, interestingly, And I tried to get a clarification from Alistair on this, but he hasn't come back to me. But anyway, that's how the legislation presently is stated, that the slaughter and compensation is only for pigs. So all the talks where I've mentioned references are there should you want to delve into that list. So there are the references, and that's it. This is my dog trying to examine for herpes virus, and that's us. And I'm just about on time. So how's that with everybody? Are there any questions or comments or anything else? Are you all still out there?
Thanks, Arthur. That's really good. I think it's like Alan wants to ask a question.
Go ahead. Alan?
You good? Can you hear me?
Yep, got you.
Yep. Regarding Kim's paper, 14 years ago, do you think you really need to be looking at IBR as a cause of abortion?
Yeah, well, I was surprised that we didn't think more about that at the time. I think, as I say, my comments were a little bit sort of trying to go by our protocol that we have now, whereby we have our approach as we go through stage 1, stage 2, if you like, which I still think is probably relevant. And therefore, I reserve my comments to say I think we should go looking when we don't find that agent. Should we be doing it as a routine? No, I think gut feeling it's probably right to do it that way around because of the prevalence that she actually reported. It does seem to be fairly low prevalence detected in fetuses, but I mean something we should consider, and it's down to expense at the end of the day, isn't it, Alan?
It is, but given the fact we've got histo in there now as well.
Yeah, but histo isn't always going to be possible on fetuses, particularly on liver. I mean, liver tends to go off pretty quickly in fetuses, doesn't it? So how many of those would be good for histo, sufficiently sensitive to pick up bovine herpes virus 1 infection? Don't know. I suspect you could miss it in quite a lot of fetuses if you went via histo and then said no, there's no evidence, we're not going to do virus exam. That was certainly if you think of those slides that I said, what was inferred by her study.
Yeah, just think given the fact that the clade type we're looking at doesn't seem to be a primary abortifacient, it's more systemic illness and dam.
Yeah. Yeah, I mean that seems to be the case, but that said, we haven't gone looking for it either in any other way other than her 2 surveys that were done, in the 90s and in the 2000s. So, if we haven't gone looking, we can't be sure we haven't got it, around. So we should keep an open mind, I think, Alan.
Oh, no argument.
Yeah, and certainly with the widespread use of vaccination at the moment, then it certainly if that's in the history, then it's certainly not warranted in going looking for it in those cases.
Do you think we should be looking more for bovine herpes virus 5 in neurological cases, or also the other 2, 4 and 6, in lymphadenopathy type of things?
I think 4 and 6, it's as I say, there's nothing out there to substantiate any significant disease at all from literature outside this country or within this country at the moment. So I think unless we had other evidence, Vanessa, at the moment, I don't think so. I think we keep our surveillance eyes and ears open, should we say, on literature, and on the basis of the on bovine herpes virus 5 causing encephalitis, then Anna unfortunately couldn't join us, and Toby's not here this week. You know, the histo is what's required to really say this is viral, and then which viral do we suspect, sort of thing. So, you know, I think we've got good tools for doing the right approach, shall we say, histo first, and then focus on which virus it might be.
Arthur, it's Harriet. I've got a question about malignant catarrhal fever. We've got a case at Star Cross last month that was quite a large outbreak. I think it was about 10 out of 40 cattle affected.
Right.
Presenting with peracute disease. Should we be looking for underlying contributing like factors to that case, or do you think it's just unlucky that such a high number of animals are affected?
I guess yes and no. I mean, you know, the principal factor is contact directly or indirectly with sheep. But it always puzzles me, you know, why then certain animals get it and not others? Is that just a chance event, or is there something in those animals that makes them succumb? And then with herd outbreaks, so I pursued selenium and copper status in the Welsh blacks, and they were low in both. You know, was that significant or not? You know, so I'm not going to say no. Don't go looking. I think first and foremost, it is the biosecurity aspects, and people are amazing with some biosecurity lapses. For instance, we had a deer outbreak with these were actually amazingly housed fattening red deer. And by the way, I didn't mention in my talk, but everybody, PM in deer is quite often really unremarkable. They don't show much in the way of gross path at all. Histopath is what's required, and doing the virus testing. But even if they don't show any lesions, get your PCR done, because deer just don't manifest characteristic pathology very often. But this particular sort of outbreak in these red deer, do you know why they got the disease? Because they used straw that had been stored in a sheep shed 3 miles away. You know, so it, you know, the lapses in biosecurity are, you know, probably the things to focus on, I think, with malignant catarrh. But as I say, even then, with absolutely, you know, the best level in more done, say two breakdowns in their deer unit says it all. You know, if you can be as biosecure as they undoubtedly would have been, yet it can be overcome still. So difficult.
Thank you. Yeah, it's definitely difficult when in the middle of the outbreak you can't really give them much that they can do to stop further animals becoming infected, because these were animals that were grazing fields that had previously been grazed by sheep, but there wasn't any direct contact. So they'd already moved the animals out of those fields. But like you say, because the incubation period can be a bit variable, you know, it was very difficult to just kind of watch these animals go down with disease.
Yeah. Usually, I'd have to say, in a couple of outbreaks I've dealt with previously, if you get to 3 weeks after you've, you know, got a clear separation and indirect, you're unlikely to get many more cases. But you know, as you say, you can't give them anything really tangible in that sense. You can only say, do this, move them away, kill all the sheep, you know, burn all the bedding. You know, I mean, you do what you can, and you watch the calendar. Difficult.
Yeah, that's good to know. Thank you.
Okay, everyone. Well, I'm hungry. I don't know about you, but till next time, I have sort of got lined up a few other sort of persons to sort of come in and give us talks over. Well, as we're close to summer holidays now, kids' holidays, I thought maybe we'll postpone one, but we've got Rob hopefully going to give us an update on salmonella shortly. So again, I'll try and sort of schedule him to do that twice again. This one, for those who couldn't make it today, well, you can't hear me now today anyway, can you? I'm redoing it on Tuesday next week. Thanks everyone for tuning in. All the best.
Thank you, Arthur. Bye.
Bye.
Thank you. Bye.